All right, so I'm going to go ahead and just jump in. The beginning stuff is always repetitive anyway. So first question with maybe just a show of hands, do we have any new attendees today? So is anyone on today that hasn't previously been on? So you can either raise your hand if you have your camera on or raise your hand virtually through it. So I don't see any hands. All right, so I'm going to assume everyone's attended at least one study group session before, so that's fantastic. So welcome back to everyone. So this is today's session, and we have a number of our faculty on today. So we have Lydia from Headquarters, who's here last time joining us. Next week's our last session, but next week she'll be busy with Quality College, so she's here if we need any support from her. We also have Laura Folk on, and Melanie Willis, and Nina Sahay. So thank you all for joining today. All right, so the exam writing, I'm not going to spend tons of time to go through. I'm just going to quickly jump through the slides. I'm not going to review the content, but if you do have any questions about the exam itself, generic questions like, what to consider, special things to think about. Hopefully you've heard this over and over for the last 4 sessions. So I'm not going to spend lots of time, but of course, just a reminder, it is 165 questions, 15 are not scored. You don't know which 15 are the ones not scored. You get 3.5 hours, which is approximately 1.5 minutes per question. If English is not your first language, for extra cost, you can get the special testing for candidates whom English is not their first language. And we do encourage you to take it because it already is a very long exam. And if you're not super comfortable with English, or, there's a lot of nuances in the terminology and reading, it's better to take that extra time. So the exam does cover FDA, EPA, OECD, and 21 CFR Part 11. These are just reminders, and all of these presentations are available in the SQA Connect community. So you can go and get the previous recordings as well as the presentations themselves. So I won't go through all of that again as we're going through the content for today. If you have any questions, etc., don't hesitate to raise them. All right, so today's subject that we're addressing is the applied expertise, evaluating and what to evaluate. So that covers overall facility, site operations, security management, functional performance of quality systems to ensure the integrity, reliability, and usefulness of the data, contract laboratories, facilities and field sites, as well as vendors or subcontractors and their associated systems for the capability to perform particular studies and adherence to the GLP standards, protocols and SOPs, systems for auditing, corrective actions resulting from inspecting and monitoring, internal organizational structure and lines of communication, personnel qualification records, so the CVs, job descriptions, training records, and training programs designed to support GLP compliance. So are there any questions specific to those topics that anyone's brought with them, or they've been reviewing material and have some questions or are not clear on anything at this point? I would like to open the floor to any just off the hand questions. I did bring a few that we hopefully will have a good discussion out of.
I have a question,
yes,
not related to this topic.
Okay.
But I had noticed for the Quality College, there's a course for like specifically on the FDA GLP preambles.
Yes.
And I'm assuming that would probably be a good one to kind of help, refresh or, instill some of the, I think it would be I guess to get your opinion, I guess it would be beneficial.
I can speak on that as well, Sherry. I've sat in on it every year since they've created it, simply because I find it very valuable, even though I've been doing this for 25 years. I highly suggest it. It is given by the FDA, as
Oh,
well
okay.
as some of the SQA members who are very versed in the preamble. They give you a promulgation that is basically all of the regulations, and directly underneath each title is the applicable preamble sections as well as the Q&A. The 87 and 78 preambles. It is a very interactive course. I've learned as much from the people in the course asking questions as I have from the FDA. It has also opened up a networking opportunity. I've met people in the class because it's typically a very small class. And we still network with questions. Hey, how do you do this? What do you think of this? How do you interpret this? So I personally very much recommend it.
Okay, no, I appreciate that. Okay, no, that's good to know. It's just a matter of, getting work to approve it. So hopefully they will approve it for us.
It's
So,
very valuable. And like I said, if used, it's helped me help others understand the why. It's helped me explain the why better. And I would impose to your management that they want staff to understand the why rather than just their QA telling them to do something because it says so.
okay, no, thank you very much.
Sure.
Thank you, Laura. Yeah, absolutely. If you do have an opportunity to take any of those courses, there's a number of courses that are typically offered regularly. So absolutely. And the preamble course is one that's offered regularly, and it really is a great course. Barb Munch, who is part of the presenting team on that one, she does have the preambles in a searchable version. So you don't just have bad scans or PDFs of like the bad old paper scans of everything. So yeah, if you're able to take the course, absolutely a great course that will certainly help. And as Laura said, it provides a lot of the why, and knowing the why does really help in terms of answering these questions in the exam correctly. But thank you for a great question. Does anyone else have any other questions at the moment? Any examples, any questions they're not sure, any material? Again, these sessions are not a training session. They're really more brainstorming, making sure you understand things, answering any questions that you might have. So it's kind of like back in our old university days when, you'd meet up, you basically didn't sit there and just expected everyone to tell you stuff. You do need to come with questions, knowing what you know and knowing what you don't know, so we can hopefully fill in any gaps for the stuff that you don't. All right, so at any point, if you have questions, please don't hesitate to interrupt. So for now, I will hopefully get some Q&A for discussions. So here's my first question. So when a deviation, whether it be an SOP, protocol, study plan, or GLP, occurs on a study, what needs to happen? Who's responsible for what action? And are there any differences between the FDA, EPA, and OECD? All right, so feel free to either type your answers or your thoughts in the chat, or feel free to unmute yourself and provide your feedback. Notify the study director. All right, excellent. Report to study director, who then determines impact. Okay, great. Anything else needs to happen? Include in the final report. All right. Protocol deviation needs to be reported. Yeah. Does anybody else have any other ideas? Potentially. Okay, so what needs to happen? So we've We have, alert the study director, issue a deviation, report it to the study director. I include it in the report. So who's responsible for what actions? So who needs to do what? So study personnel is responsible to report it to study director, as well as QAU notifying study director. Excellent, yes. So study director needs to be notified. And are there any other actions we haven't covered? Any other responsibilities? Management is responsible for determining study impact. Not quite. That would be study director. Okay, management. So that may be an aspect in your site's process, but from the regulations, management doesn't need to determine impact, study impact. That would be the study director's responsibility, because who can tell me why? Why is it the study director's responsibility? Yes, TFM needs to be aware. That's right. They have overall study responsibility. They're single point of control for the study. So the study director is the grand poobah of the study. And I'm aging myself if you know what that term grand poobah is. It's from the Flintstones, for those of you who are 80s babies or 80s and 90s kids. All right. So yes, so the study director is responsible. So they will assess the impact to the study. Is there anything else? Does QA have any responsibilities? Who thinks QA might have some responsibilities? Nobody? If QA finds it, they should report it. Yeah. Report to study director management if found during audit. Yeah. There was a hint. Look at 58.35. Verify that they were referenced in the report. All right. So I'll put you, there we go. B3, there we go. So 58.35 B3, QA is responsible to ensure that no deviation from the protocol or SOP occurred without proper authorization and documentation. So under the FDA's, oh, sorry, B5, yes, sorry. I have B5 in my notes. I read that incorrectly. Yes, thank you, Laura. So QA is under the FDA, it's QA's responsibility to ensure all deviations have been authorized by the study director. So the study director has to authorize them, but it's actually falls under QA. So sometimes when you see those warning letters, those presentations on warning letters, they do, they do cite deviation was found and they cited it to QA. So that's the basis for that. All right. I'm going to just jump back to a few other little things. Then I'll tackle that last part. Any differences between FDA, EPA? FDA and EPA are pretty much the same on deviations, but there might be some subtle differences for OECD. So when a deviation occurs, whomever deviated or identified the deviation should advise the study director. So a deviation should be created, which aptly identifies the deviation. So you want to make sure that the deviation is clear about what happened, right? And while it's not in the regulations, I think most companies have that stance of, explain it clearly, like someone who potentially hasn't been doing the entire study would understand what happened, right? Because the agency may come and just spot check some deviations, and they don't want just a random statement of SOP deviated, like what SOP, what activity deviated, etc. So under FDA and EPA, the study director has to authorize the deviation. Under OECD, they actually use the term acknowledge. So that's from 5881A from the FDA's. I didn't slot in the EPA's because EPA, it's the 160 and I think it's 160 and 720, but it's still the 0.81A. From OECD, it's 282B and 211.22E. So study director must assess the impact to the study, of course. Deviations impacting the study need to, protocol, study plan, GLP, and potentially some SOPs need to be included in the report. So got that already, 58.185.8 or 299.2. So QA is under FDA, QA is responsible to ensure that no deviation from protocol or SOP occurred. That's under 5835B5. So what is the subtle difference between FDA, EPA? We're lumping those two together in this specific situation because it's the same, or versus OECD. So who can think of a difference from OECD? Okay, so I'll give you a hint. It's in terms of, use your compare chart. Great hint, Mel. It's in terms of who's responsible. So remember, we just said under FDA and EPA, QA is responsible to make sure no deviation occurred without proper authorization. Under OECD, that responsibility goes to someone else. Who do you think it goes to?
PI?
Not well, PI would be responsible for their deviations. Absolutely. Yes, study director. Thank you, Diane. Study director is responsible to ensure the deviations are addressed. That's under 1.22E. So it's still the same process, but if there's a citation under OECD, they're going to flag the study director. Under FDA, they're probably going to flag QA. So that's one of those subtle differences that if you go to your compare chart, you will see those subtle differences. All right. Anyone have any other questions or anything else to add on that?
Would you mind repeating the reference for the OECD, the 20, I don't know if you said 29 or 28 or 22?
Sure, in terms of SD's responsibility. So it's section 2, 1.22E. If you do access the PowerPoints that are in the community, it's all in the notes. So anything I'm saying, I'm not reading off the top of my head. I put that in my notes section already. So I know someone referenced other sections, 3, 4, and 5. Ashton, I'm sure you're right. I don't have time to pull out. I do have my handy regs, which is FDA and OECD, and
all 3 could apply.
Yeah, exactly. So, all right. So hope that was a discussion. All right. So the next example, sorry. A sponsor hires a contract research organization or CRO to run a GLP study in accordance with OECD. So they're the test facility. They advise that another CRO will act as a test site and conduct the bioanalysis and toxicokinetic analysis for the study. What is the test facility expected to do concerning assessment of this test site? What role do others play in for multi-site studies? So who wants to tackle that? Who has any information? So you have a sponsor, they hire a company to run GLP study under OECD. So that's going to be in Canada or Europe. and they indicate that they have another company that they want to hire to do the bioanalysis and TK data analysis. And so what does that test facility, what are they responsible for? And who specifically, what roles? What roles have specific requirements there?
I was gonna say the CRO has to appoint a PI who's going to act on behalf of the study director and then have that communication with the study director.
Yeah, excellent. Great. Does anybody else have anything else to add? There's actually lots and lots of stuff
I
in
guess
this.
to make sure that the facility is adequate to conduct the study, I guess.
Sorry,
what
yes. And
size
who did you say is
personnel.
responsible for that?
The test facility? Or is it the test site?
Does anybody
believe-
know? Can anyone help Diane out? So a lot of this
Oh,
information.
management? Okay.
Yeah, sorry.
I was gonna say test facility management.
Yes, ding, 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 you are correct. Test facility management. So even if the sponsor designates the test sites, the test facility, so this test facility CRO, the one running the study, is still responsible for ensuring that an appropriate principal investigator is assigned to the phase and to ensure clear lines of communication. So the test facility management is responsible for that. But there's a whole lot of other responsibilities in there. This is where OECD Guidance 13 comes into play. And that's one of the ones that I did stress, that we've previously stressed, that it is important. So under OECD, they have a lot of guidances, advisories, documents, etc. There's up to 24 already. But the ones to know that you should certainly focus in on is definitely 13, because that talks about multi-site. And while the FDA doesn't have a stance on multi-site, so they won't cite you to it, it is for the most part standard practice across industry, simply because currently FDA doesn't have anything regarding that, because back in the late 70s, things were pretty much done single site. Yes, thank you, Melanie. So OECD member countries include more than just Canada and Europe. I was giving the typical example, but absolutely there are a number. And there's a number that are member countries, and then there's also
it's called, I think they're called partner countries.
Thank you.
I actually
Yeah.
gave this website
Yeah.
there, but they're like becoming members, or they are tentative members,
or not quite accepted. So there's their partners. So partners tend to get a little bit more tricky. So the exam I do not think the exam will go into specifics about partners and stuff like that, because that's way too intricate for anything.
No, I just wanted that to be a resource. I didn't want,
Yeah.
if we say one thing and there's more, I just wanted that to be there. Thus side.
Absolutely. But yes, there are plenty other members, like Japan. Japan is an OECD member country. India, there's a whole bunch. All right. So, but under guidance 13, so can anybody, hopefully people have looked at that one, because that one is a great one. It does highlight a lot of the information, and it really doesn't differ significantly from common sense approach to FDA GLPs in a multi-site scenario. So let's go maybe role by role. So let's shout out a role and then tackle what they would be responsible for. So who wants to say a role involved in a multi-site study?
Well, the principal investigator.
All right, principal investigator. Okay, excellent. So we'll tackle TSM next. All right, so principal investigator. So what are they? They're the person who's acting on behalf of the study director, right? So they're the eyes and ears of the study director at that facility. So they're an extension of the study director at that different location. So what are they responsible for?
Well, like we just said, any deviations are reported to the study director.
Perfect. Deviations are reported to the study director. Excellent. What else do they do?
Employees, I guess, running the study have the knowledge and expertise to run the study.
Sure. Do they provide anything at the end of their work?
The report?
Yeah, they provide a report if applicable. Sometimes under OECD, a principal investigator does not necessarily have to provide a report if the information is going to be included in the main report. So typically, if they're actually assessing, doing actual evaluation, then typically there will be a report, but you may have a test site that's just doing generic work. So, your pathology area is really busy, so they're just preparing your tissues to slide and sending them back for the test facility to do the analysis. So they may not necessarily provide a report, but they still need to provide one thing for sure. Can anyone advise what that is? Yes, thank you.
Oh, sorry.
Oh, sorry. Go ahead.
Compliance statement.
Absolutely. They need to provide a statement indicating to what level of the GLPs the work fell under. And then, of course, the PI is responsible to make sure either all the data and material is either sent to the study director, or what's the other alternative? What do they do at the end?
Samples are
Archive. Yes, ensure archival. Great.
I was going to say something with samples are discarded or sent back.
Yeah. So the guidance 13 basically says that they return the material, the data and everything, or they archive it, whatever the study plan indicates. All right, so let's tackle, since we did PI, let's do test site management. So what's test sites management's responsibility?
Do they have to assure that the site is adequate to conduct the study?
Absolutely. So it needs to be adequate to conduct the work. And of course, they need to have the resources, materials, etc., equipment. And what do they do in terms of personnel? Enough manpower? Absolutely. And do they assign or replace anybody? Yes.
Yeah. Like the designee for if a PI is out or sick or someone quit, they are responsible for assigning someone in their place.
Yeah, exactly. So the test site management is going to assign a PI and replace them as well if necessary. So that kind of sounds like the test facility management study director, right? So your test site is kind of like the test facility in a smaller scale part of the test facility. So your PI has a lot of responsibilities similar to the study director, but for their portion. And then the test site management has the same responsibilities that TFM would have for their location in their phase. So very similar. All right. There's one more main role at the test site before we jump back to the test facility. So who can think what that is? You may be it. QA, yes, excellent. Of course.
Independent, I guess an independent QA. Yeah.
The guidance doesn't require an independent QA. It requires an independent QA if there is test site QA. However, it can be deemed that the lead QA will perform QA activities if required. So it doesn't have to, but we're going to assume. And yes, so they got audit reports need to be submitted to QA, SD, TFM, and a few more people. Who else would QA at the test site need to submit their reports to? PI and one more person. TSM, excellent, good job. Yes, so the test site is reporting to a whole bunch more people, right? So they're going to report their audits to the PI and test site management, study director, TFM, and lead QA. That's right. So they, of course, have the same type of responsibilities as lead QA. So they have to maintain a copy of the study plan and amendments. They have to inspect PI's contribution, and what are they going to provide to show that they've done all that stuff?
Audit.
statement.
Oh, yeah.
All right, I missed that, Diane.
Oh, I said QA statement.
Yes, QA statement. Good job. Yes, I see some of you putting that in there. Absolutely. The QA statement. So they're going to provide the QA statement for that final contributing report. Or even if there's no report, there's still a compliance statement and a QA statement. All right, so that's the test site. So let's jump back now to the test facility. So let's start. So we have 3 roles there. Let's start with, which role do we want to start with first? Let's
QA.
go with study director. Can we start with study director? Let's start with study director. What are they responsible for?
Overseeing how the study is performed.
Yeah, absolutely.
Yeah, study conduct.
Study conduct. And what are they responsible for in terms of like the test site, interactions with the test site? So what do they have to make sure? They have to provide a copy of what to the test site and all personnel?
Protocol.
Yeah, protocol or an OECD study plan. Yes, study plan, protocol, and amendments, of course. What do they have to put in the study plan about the test site? Is it a hush hush secret, or do they need information in there?
The PI.
Yeah, they have to list the PI.
I actually
They have
do
to-
have a question talking about the protocol and amendments. Because I do work at a CRO, and we always do check to see, do we have the protocol and all of the amendments? Even if the amendments don't affect us directly, we are still responsible to have all of those amendments, correct? Okay.
Yes, it's
We get pushback from the PIs a lot of time when we
Yes.
ask.
yeah, sometimes depending on how much experience the CRO has with multi-site, sometimes there is pushback. I'm in Canada, and our PIs, had pushback before too. They're like, we've asked for it, they don't want to send it. And the QA, the test site QA should have all the amendments, even if it doesn't apply, because
So that's where
sometimes-
they try to say, oh, this doesn't apply to us. And I try to say, it doesn't matter. We still need okay.
Yeah, because sometimes you don't realize that the material can apply. Sorry, Melanie, go ahead.
Yep, you just answered the question. I said, so let's go with the why. Why is it necessary for you to have all of them? And that's exactly it.
Yeah, because it shouldn't be the study director deciding if it's relevant to QA, right? Because sometimes people don't make the connections. Oh, they changed the tube for TK analysis or TK sample collection. Well, that might affect the bioanalysis. So, they're like, oh, well, that's only the sampling. Well, that impacts. Or, oh, they've changed, the species. It doesn't really affect, you're still getting samples. Well, kind of affects for validation. All right. So there's lots of information. So yes. So study director has to make sure the study plan and amendments are made available. They have to include the PI and the work that test site's doing, right? They need the location, and they need to have that information of what they're doing and as much information, any softwares and stuff like that encompasses the requirements. What do they need to do with the PI? Do they just send them an amendment and the protocol and amendments and don't ever talk to them?
I know our PIs sign I can't think of what we call it, but they do sign that they've acknowledged that they've received the protocol, they've read it, they understood it.
Absolutely.
I guess acknowledgement, I think they call it
Yeah,
a,
test site acknowledgement form, yeah.
Yes.
And so basically the study director needs to have open communication. Super, super important, right? Because, you know, this person, this PI is acting on behalf of them, but they're the single point of control. They still need to know what's going on. And what do they do with the report or the documents the PI provides at the end of their work? Do they just put them in the binder and send it away, or do they include it in their report?
I always kind of explain it when I do training that we're like a little piece of the big puzzle. And
Mhm.
our report, even though our report looks really big, it goes into this final report, this big final report. So we're just, I always say, a little piece of the big puzzle.
Absolutely, yeah. So the study director is going to put that piece of puzzle into their big report and also assess, you know, what any information came from that, right? So they're going to report on the results, like, so with the TK, what does that mean about the overall objective of the study, etc. All right, great. Now let's tackle test facility management. So what are they responsible for? Concerning test sites. They have a lot of responsibilities as TFM, but just in terms of a multi-site and test sites. So they're actually responsible to approve the selection of the test site. Yes, thank you, Ashton. Good job. So they have to approve the test site. So even if the sponsor decides that, hey, we've chosen company Y who's going to do the work, that's not a problem, but TFM still has to approve that selection. Absolutely. Thank you, Rebecca. They have to designate a lead QA. So they have to make sure that there is a QA for the test site QA to liaise. And what's the last thing? Last main big responsibility. I'll give you a hint. Open lines of
Communication.
communication. Absolutely. Again, you know, these two companies might be a few miles away. They might be a few countries away. So you want to make sure that there's communication and appropriate open lines, right? That includes, you know, people being able to communicate in hopefully the same language or have an understanding of that, and making sure that, you know, PI speaks to study director speaks to PI, lead QA, and a test site QA. All right, final role is lead QA. So what are they responsible with associated with the test sites?
Can you explain what you mean by lead QA?
Yes. So lead QA is going to be the QA at the test facility.
Okay.
So they're going to be in, because ultimately they're going to be responsible to verify that final report is inspected for compliance, including that contribution from the PI with the test site. So they're going to want to make sure that, you know, they have responsibility for auditing that full big piece, and also making sure that any contributions from test sites followed the study plan, that the audits were done, etc. as well. They're not going to re-audit that study or that report, but they are still going to confirm that the study plan requirements. So yes, keep communication with test site QA, review test site audit reports. Absolutely. So there's a fun little word, liaise, that is used for QA. So everyone else talks about communicating, but lead QA liaises with test site QA.
What about the client audit visits when they come and visit one of the sites to review their data, or is that a part of the lead QA, or they probably have other designated QA that do site visits?
Well, lead QA is a term basically that's describing not necessarily a designated person, but like lead QA is the QA at that test facility.
Mm-hmm.
Test it. So in terms of sponsor visits, that is technically outside the GLPs, but yes, they may come, and depending on how a company runs, it could be a smaller shop, and the test site QA, the lead QA might be the ones hosting that, or it may be a different part of the QA group that does it. But yeah, ultimately lead QA is not like Sherry. Sherry's not lead QA, not typically.
Okay.
Although usually they will have a designated person entered in the study plan. So test site QA has someone to physically send out the audits to. If not, then test site usually says, please send a copy to lead QA.
Okay.
All right. Any other questions on this? So hopefully that makes a little bit of sense. When it comes to multi-site, think of that test site as sort of like a smaller version of the test facility, but still owning all those responsibilities back. So exactly how Diane described it, a small puzzle piece just goes into the bigger puzzle.
I have a thought, something to think about. I was actually asked today so we are a testing facility, and we have a test site that just so happens to also be the sponsor. So they're a sponsor, they're also acting as a test site. They asked if, instead of us auditing them, if they could just take full responsibility for all of the work being done at the test site. What do you guys think about that? Is that okay?
Sorry, I missed the last part of what you said, Laura. They asked if what? They could what?
Instead of us doing a qualification audit of them to assure that they have procedures in place and for quality data and all that good stuff, they said, why don't we just state that we will take full responsibility for all of the data and the work happening at the test site? So what would your response be to that?
Wouldn't that conflict with like the agreement of utilizing an organization that has a QA? Like, wouldn't that kind of like muddy things up? I get that they want to do their own, like what I'm understanding is like have the test site do all the testing, but they're basically saying, well, our QA will just do the QA part instead of the test site's QA.
And
But
that's okay. That's okay that they do the QA part.
So
that's fine, because normally a test site will have their own QA, which was what Sherry was talking about earlier. The lead QA would reside at the testing facility, and each test site might have their own QA. But they were asking specifically, can they take, instead of us auditing them to assure that they have procedures in place, they said, is it acceptable, instead of the testing facility taking responsibility for that work, can they take full responsibility? So
Are they asking to
the term responsibility, that's kind of what I'm
audit themselves? I think.
Well,
yes.
Okay, so here's my question. Where does it say that the test facility must audit the test site?
It doesn't. So not necessarily audit, but we have to do our due diligence to assure that they have something in place.
Yes.
Yes, so not necessarily audit. It's however your process is defined for your testing facility. Some people might go audit, some people might review things, whatever your process is. They didn't want any of that to happen. They said, it's okay, we'll just take full responsibility. Is that okay for them to take full responsibility for that work? Who has full responsibility for the overall conduct of the study? That's what I'm getting at.
Study director?
There you go.
Yes, but it's not actually under OECD 13. It's not the study director's responsibility.
For the data for their GLP study.
Yes, they're responsible for the data and everything, but whose responsibility is to approve the test site?
Right.
TFM.
TFM, that's right. So that would have to be a discussion in terms of, you know, the initial answer, I would say, and maybe feel free to disagree. I would say, no, we can't just push that responsibility aside. You would absolutely need to figure out other ways to confirm. Now, the United States, is a little different than many other OECD countries, because what's one of the main differences between most OECD countries and the US? I will tell you. Yes, regulations are law. Many of the OECD countries, the OECD principles of GLP have been adopted into law. That's not the case in Canada, mind you. We have this wonderful little thing called a GLP certificate that is issued by our monitoring authority. Now in the US, FDA and EPA do not issue certificates. However, in Canada and Europe and many other OECD member countries, they all have a GLP certificate. So that's one of the first steps you could do to check. So if they're in Canada, you would check if they have a GLP certificate. If they don't, then the sponsor, doesn't matter what the sponsor wants to do now, the sponsor is not GLP.
Exactly. And that's the discussion we had. That's exactly what I told them, and I think they eventually understood. But that comes up a lot, and it can get very confusing. So I thought that would just be a good quick discussion.
No, that's fantastic. Real life examples are always so much more easy to understand and great to learn from. So thank you for that, Laura. All right, we'll move on to the next one. Okay, so a software is purchased off the shelf, which is commercial off the shelf, COTS, if you've ever heard of COTS. I used to hear COTS and I never understood what that was. So it's commercial off the shelf or commercially off the shelf. The vendor of the software claims that their software meets Part 11 requirements. They also validated many aspects of the system. Prior to using the software at your facility for GLP work, what are some steps you are required to take?
Validation of the software, computer system validation.
Sure. We use the term validation, but strictly speaking, it has to be assessed. Under OECD, they use the actual term validate, but under FDA and EPA, they just say assess.
So the part of 21 part 11 assessment has to be done. My organization, we also do a part 58 assessment, user requirements, and then the validation summary report to be audited as well, and any change requests.
All right, excellent. That's a lot of information. That's a lot of great answers you had. Good job. Melissa, you also have something there, audit, assess the vendor. So yes, ideally, that's a really great idea to make sure, you know what's going on, especially if they're going to be doing some support, right? If they're going to be, like if they're offering cloud services in terms of, electronic, archiving or anything like that, any sort of service that they're providing, you absolutely want to make sure the vendor's been audited. But then, yes, a lot of the good stuff that I don't anymore that you said through. So you want to assess the system, and you said something really important there. So even though the vendor did Part 11 requirements, you assess them for 58.
Yeah.
Who can explain why that is super duper important?
Just because we can't, I mean, it's nice that they do it, but we can't rely on their assessment to ensure that the software meets the standards. And also, in order for us to do an adequate assessment, we have to show that we did do a Part 11 and Part 58 assessment on their software.
Absolutely. And one of the reasons, the interesting thing about Part 11, it's for those of you who are like been around for forever and had the training back when Part 11 kind of first came out. Part 11 moves back to the predicate rule, right? So you have your Part 11, which you can apply to GCPs, your Part 11, which you can apply to GLPs, to GMPs. Part 11 is just talking about the softwares. But if you're doing GLP work, you want to make sure all those software rules apply to the GLPs, right? The GLPs are our base. So Part 11 is super duper important, but you want to make sure it's Part 11 compliant to meet your GLP requirements.
Yes.
So great. So yeah, you want to do your IQ, OQ, your PQ.
I was gonna say, don't you have to make sure it fits what your specific need is?
Absolutely. So when you're validating or assessing, whatever you want to call it, you want to make sure it meets the requirements based on your usage, right? Because the vendor said it met requirements, but what are your requirements? The vendor's requirements may not be the same. So yes, great point, Diane.
Yeah.
What else? Do you maybe need to provide some training? Yep, training would be a good thing.
Mhm.
And what about different access levels based on people's roles? You want to make sure that's there. What else do we need? What do we need for almost everything we do in the GLP world?
SOP.
Thank you. SOPs. We need SOPs on how to use this. Absolutely. We can't just all sit down and use it the way we want to, right? Everyone has to use it the same way.
A validation plan.
Validation plan. Yep. All those fun documents. And what else do we want to make sure? All those records that the software is gonna generate. What do we want to make sure happens with those records?
What, like disaster recovery or decommissioning plan?
Yes, that's a further step, but yes, archived. Archived is what I'm looking for. For your study, you want to make sure that data that you generate can be archived. It's readily accessible, right?
So RQA does audit or review the records. I don't know if that's a requirement for other QA.
I think many companies do have QA overseeing those validations. Absolutely. It's really good practice. It's not, of course, explicitly stated in the GLPs, but certainly very good practice. All right. So good. Great job, everyone. So excellent. Any other questions on that? Sorry, Han, I will pull out that information. If I don't get it for you, I will send it out to you. But the
answer it. I'm slowly typing. I'm just not fast enough. But the answer initially is that like FDA and EPA require that all unforeseen circumstances that might impact integrity and quality of the data are required to be in the final report. A specific compliance statement is not required to be in a study final report. Compliance statements are required from the sponsor under different regulations, from the sponsor during submissions to the FDA or EPA, which is why many companies choose to write their compliance statements to ease the process for the sponsor. All that is required is that all unforeseen circumstances be reported. And so all of those non-compliances would be included because they are circumstances that may impact the integrity and quality of the study.
Yeah, and under OECD, it's section 9 for section 2(9) reporting of study results, and 9.13. So the final report should be signed and dated by the study director to indicate acceptance of responsibility for the validity of the data. The extent of compliance with these principles of GLP practice, good laboratory practices, should be indicated. So that's another subtle difference between your FDA and OECDs. And of course, there's a reference to compliance in guidance 13. All right, so the last question that I have for you all today, it's a bit of a long one, but I think we covered it, so I think there'll be a fast answer. So on a GLP study, the dose formulation analysis is conducted at another facility from the testing facility. At this location, there was a non-study specific deviation issued for freezers as the temperature was not monitored for 24 hours. One of those freezers housed the dose formulation samples for the GLP study. The contributing scientist assessed impact on the samples from that non-study specific deviation and included in the study data package. QA conducted the audit of the phase and the phase was finalized. The deviation was not included in the phase report as the contributing scientist deemed the freezer issue did not impact the samples. Are the actions appropriate? Should the contributing scientist or QA, in this case, test site QA? Yes, I understand. Yeah, no, I know. I have 3 screens open, so it's a little bit. Okay. All right, there we go. So, did they do enough? Did the contributing scientist or QA, in this case, test site QA, should they have done something? Ah, there we go. So thank you, Nafisa. Yes, report to the study director. So even though it's a non-study specific deviation, because there was potential impact to that study, the contributing scientist was still responsible to report to the study director. So the contributing scientist should have done that. And what should have QA done? Should QA have done anything? If you were auditing that, would you have done anything?
Notated in the QA audit report, right?
That's right. They should have flagged the contributing scientist that, hey, you didn't send this deviation to the study director for impact. So so hopefully if you caught on to this one, we were calling it testing facility and contributing scientist. It was just a generic term. There was no PI, no test facility. So this was actually an FDA example, right? US still has multi-site studies. So that's why I was pointing it out, because QA has responsibility, right? QA is going to be the one cited if deviations haven't been assessed by study director. So good job. All right, so that's it. We're at the end of the hour. So hopefully these were some great questions, got you thinking about some of the OECD stuff. I know many of you typically have probably more experience with the FDA based on many of the comments. I'm not assuming here previous comments from sessions. So hopefully this allowed you to balance out some of those FDA versus OECD approaches. So as always, thank you. Thank you for posting that, Melanie. So thank you all for your attendance today. There were some great conversations, great discussions. Thank you for your participation. The PowerPoint will be available with all these citations that were quoted, so they will be in there. And again, please come. Next week is our last study group session, so please come with any questions and hope to see you all then.
Thank you.
Thank you. Really good.